Welcome back. Summer is just a few short weeks away and families are gearing up for vacations. However, studies show summer youth camps are experiencing a decline in attendance from children, leading to an increase in child obesity along with several other health issues. Joining us now to discuss how parents can keep their kids active and healthy is pediatric endocrinologist Dr. Rinku Mehra. Doctor, thank you so much for joining me.
Thank you for having me. I appreciate being here.
Now, can you tell us a little bit more about your practice as a pediatric endocrinologist?
Yes, so my practice is based in Virginia, but I see patients across the country in 4 different states. And I see children with hormonal conditions. In addition, I counsel patients on concerns about weight and weight management and healthy living. And I see children age 0 to 25, both in person and virtually. And I'm located primarily in Virginia and Maryland, but I see patients in Virginia, Maryland, Florida, and Iowa right now.
Now, what makes, the Mirror Clinic different and unique compared to, possibly other clinics?
Yeah, so our clinic, my clinic was really designed to spend more time with patients. And so, I have an hour blocked off for my patients. What I found when I was in a traditional healthcare setting was that I had, 10 to 15 minutes with my patients. My patients and their parents often left confused because I didn't really have enough time to spend with them, and they didn't even know how to get back in touch with me. So my practice style now is that I have an hour per patient for their new patients. I have 30 minutes for follow-up appointments. And then I give patients my direct contact to my email and text messaging. And so they can really access me for any questions or concerns. And it's more about, high touch environment where they know that I'm an advocate for them and for their child's health.
Now, as I mentioned, there has been a decline in summer youth summer camp attendance, which has led to poor health outcomes for many children. Can you just explain, what are some reasons for this? Why are we seeing this? And, um, in response to that, why is this kind of unfortunately having a negative impact on children's health?
Yeah, so, I think, summer camp traditionally has been a great environment for children to go during the summertime to make new friends, to learn new activities, and to, explore interests that they would not have been interested in otherwise. I will say that there's been a decline after the COVID-19 pandemic. I think that, COVID-19 really palpably altered the contours of many industries, and summer camp was affected as well. Parents had to worry about the safety of their children. A lot of the camps were shut down during the COVID-19 pandemic. And then many workers, both parents, mother and father, or both, both parents, ended up working remotely. And I think the impact of that has been sustained for the most part, in that, parents started looking at their finances as well and saying, we're spending so much money on on summer camps for the kids, and we're both at home. Um, does it make sense for us to spend that type of money? Just to give you a sense, I mean, a overnight camp can cost up to $7,000 to $9,000 for the week, and a lot of parents can't justify the cost of that. Daily camps also cost anywhere from $400 to $500 a week. And if parents are both at home, it's sometimes not making sense for them to have these children go to camps and spend money there when the parents are both at home. So I think there's also health and safety concerns that have continued post pandemic. Parents were worried during the pandemic of keeping their kids, safe and prevention of COVID. And I think some of that they realized during the pandemic that they could keep kids at home, they could keep them engaged, and there are some remote learning opportunities that they can do. And so I think the cost of camp and transportation issues that parents have, and then remote learning all have shifted the summer camp experience.
And in response to that, we're seeing, unfortunately, children are gaining weight and are kind of leaning into more unhealthy habits. Can you talk a little bit more about that and how it's affecting the child, the health of the child?
Yeah, so, I think again, we as a society have started moving more towards stationary behaviors, and children in general are exposed post-pandemic again to, more screen time, more phone use, video gaming, and they, as a result, are moving a lot less, and they're allowed to, or they're exposed to more food availability at home, and so that sort of impacted children gaining weight and being less active. And it was increased before the pandemic, but I think post-pandemic it's gotten worse. As a result, we have seen this explosion of children who have had, not just weight gain, but obesity and early puberty, because those are direct impacts of weight gain and, early menstrual periods in young girls. And so, these changes that we have in our lifestyle make significant impacts in the health of our children, and then in their health as they move into adulthood.
Now, I also want to add into that. I know here in New York, we often have a lot of food deserts and a lot of food insecurity. And so, a lot of families who are maybe in poverty, or maybe they're not in poverty, but they just live in areas that don't have access to healthy food. That's also a reason why we see sometimes these families kind of adopt unhealthy eating habits. Is that something that you've noticed in your practice? And is that also something that could be contributing to why children are, kind of leaning more in towards obesity?
Yeah, so interestingly, when we have environments where there are food deserts, we do see, an increase in weight gain, interestingly. And the reason for that is that there's less exposure to healthy food and, fruits and vegetables, or the fruits and vegetables that are available are much more expensive than some of the other types of food that are higher in caloric density. And so we're definitely seeing that across the US and probably across the world, to be honest, because, as you know, the cost of groceries and food has increased significantly post-pandemic in the past, several years. And families are just not able to afford the healthier food options.
Right. And I'm so glad that you pointed out that with summer camp, you kind of put some prices in there that let people know that summer camp is pretty expensive. And so, when you have a parent that has to think about whether buying groceries or taking their kid to summer camp, of course, the groceries are going to come first. But even with that, it's very expensive, and not often people have the resources to buy the healthier food. Do you have any advice for parents when it comes to, I guess we can talk about just staying active first and then talking about healthier eating later? What advice do you have for parents who may want to help their kid be a little bit more active, especially during this time where we're kind of post-pandemic, but still some of those behaviors we see we still kind of take on some of those behaviors that we had during the pandemic?
Yeah, so I mean, I think the first thing to do is really focus on eating habits as a family. I hear many parents say, well, she, has to eat less, or my other child, you know, doesn't have a weight problem, so they can eat whatever they want. And I think the first thing we have to focus on is what can we do as a family to change our eating habits? What can we take out of our home? What types of food are there that are probably not good for anybody to have? I think that's the first thing, is really focusing on the family. The second piece of it is what activities can we do, whether it's outside or in the home, that get us active. If you, are someone who, likes to track steps, I think, everyone has a phone. If you, even track your steps, even walking outside, I think, I checked, if I don't make an effort, I probably only walk 1 to 2,000 steps a day, because I'm in an environment and a job where I'm sitting almost all the time. And so I think just getting out and getting more steps in and walking, I think is helpful. It doesn't have to be anything high tech. You can watch YouTube videos, to do exercise if you want. And, how can we do that as a family? So if we focus first on, our activity and our movement, I would start there. And then as far as the food is concerned, taking out some of the higher calorie foods, making sure that, everyone in the family is eating similar types of food. And even looking at your grocery stores and seeing, can you buy some of the frozen vegetables or frozen fruits, because they tend to stay longer and you can use them easily in dishes, and having, vegetables available with some healthy protein sources, even in the, if they're frozen, I think that's healthier, a healthier option than doing takeout or stopping at your local fast food restaurant for food.
And I also want to add that losing weight and being healthy is a very difficult task for anybody. So I can imagine that it may be a little bit more challenging for somebody who is a teenager or a child. Can you talk about some of the challenges that come with it? And, what can parents look out for so that they're well equipped to deal with those challenges?
Yeah, so during puberty, there's a lot of hormonal shifts that happen in both boys and girls. They tend to be hungrier, they tend to want to eat more. And so, what they gravitate towards is whatever really is available for them. So, if you have higher calorie foods in your pantry, your teenagers are going to gravitate towards that. Not to mention, a lot of these teens are very busy. They're busy with school, they're busy with their activities after school. Sometimes they're running from activity to activity or social events. And so, really having healthier food available at home is important for the teens, recognizing that they may be hungry, and maybe focusing on foods that are, cut up or easily available to them when they open the fridge. Are there things that are healthier choices that they could pick over some of the higher fat and higher calorie foods in the pantry?
And I also, understand that this can be a sensitive time for, a lot of adolescents, and, dealing with weight can be a sensitive subject. How should parents approach that with being mindful that they're not saying anything that can kind of trigger the child to feel maybe negative about where they are in regards to their body weight? What are some ways that we can be just a little bit more mindful and, be supportive, but not to the point where it's making the child feel self-conscious about themselves?
Yeah, so this is a very sensitive topic, and I think what we want to do is be aware of what our words are. Our words matter. The things that we say to our children matter, and really focusing more on health as a family rather than pointing fingers and saying that making negative comments about weight or calling someone very overweight or obese even, because I think children are very sensitive to that time, to this time, and really sensitive of their bodies. They are sometimes even made fun of at school, and so being recognizing that, being open, having open communication with your children, just to sit, make sure that you're available and that they feel comfortable talking to you when they have a problem. But really, my approach has really been to be very sensitive and really focusing more on health. That we want you to be healthier, want you to be able to run faster, do certain activities faster, and we as a family want to be healthier and focus on our health so that we can, move faster or do certain activities together, and live longer and prevent going to the doctor actually.
And I also want to add, just coming from the Bronx, we have so many cultures, and within these cultures, there's foods that are rich, and they have so much going on, and we love to eat those foods, but sometimes those foods can be a little bit unhealthy for us. What advice do you have for people who may struggle with wanting to stay close to their cultural identity, but also still wanting to have a healthy option?
Yeah, I mean, this is a very good question. And, I know for myself, in our culture, our food is very rich in caloric density, very rich in fats, and, higher fat. And our culture, in my culture in general, we have a higher incidence of type 2 diabetes. And so I think it is very important to, maintain close to your culture, but maybe finding out some substitutes. For example, instead of cooking things with heavy cream or, milk based, are there things that you can substitute with, water or vegetables, like, water and, lower fat types of oils like olive oil? Can you cook in olive oil instead? Can you base your food more with vegetables, over some of the creams and heavier type of food that actually are more satisfying to you, but actually tend to have you gain weight? And over time, can you change how you're eating, one day at a time? So not with every meal, but can you swap certain things out for healthier options? Starting with a salad, I think, is always a good option. But each culture is going to be different, and so really looking to see, are there things that you can, take some of the higher caloric content of these foods out and swapping them for lower fat options.
Well, Doctor, I want to thank you so much for joining us and educating our community.
Thank you so much for having me. My pleasure.
To learn more about Mehra's clinic and walk with Dr. Mehra, please visit her website, themehraclinic.com. Unfortunately, that is all the time we have for today's show. I want to thank our guests for joining us and you, the viewers, for tuning in. Keep following BronxNet TV for continued coverage. Thank you for sharing this space and time with us.